How COVID-19 spreads. The rapid spread of the coronavirus and the illness it causes called COVID-19 has sparked alarm worldwide. The World Health Organization, WHO, has declared a global health emergency, and many countries are grappling with a rise in confirmed cases. First, let us have a quick history of COVID-19, or popularly known as coronavirus. Coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people, such as with MERS-CoV, SARS-CoV, and now with this new virus, named SARS-CoV-2. The SARS-CoV-2 virus is a beta-coronavirus, like MERS-CoV and SARS-CoV. All three of these viruses have their origins in bats. The sequences from US patients are similar to the one that China initially posted, suggesting a likely single, recent emergence of the virus from an animal reservoir. Early on, many of the patients at the epicenter of the outbreak in Wuhan, Hubei province, China had some link to a large seafood and live animal market, suggesting animal-to-person spread. Later, a growing number of patients reportedly did not have exposure to animal markets, indicating person-to-person spread. Person-to-person spread was subsequently reported outside Hubei and in countries outside China, including in the United States and recently in the Philippines. Some international destinations now have apparent community spread with the virus that causes COVID-19. Community spread means some people have been infected and it is not known how or where they became exposed. Now, let us learn on how does COVID-19, or well known as coronavirus, spreads. Person-to-person spread. 1. Between people who are in close contact with one another, or called as direct contact transmission. Direct contact infections spread when a disease-causing microorganism pass from the infected person to the healthy person via direct physical contact with blood or body fluids. Examples of direct contact are touching, kissing, sexual contact, contact with oral secretions, or with body lesions. 2. Through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Droplets generally travel between 3 or 6 feet and land on surfaces or objects including tables, doorknobs, and telephones. Healthy people touch the contaminated objects with their hands, and then touch their eyes, nose or mouth. Spread from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. Can someone spread the virus without being sick? People are thought to be most contagious when they are most symptomatic, the sickest. Some spread might be possible before people show symptoms. There have been reports of this occurring with this new coronavirus. Chinese researchers have confirmed a case of asymptomatic transmission of the new coronavirus. A 20-year-old woman from Wuhan passed it to 5 of her family members but never got physically sick herself. The case study is the first concrete evidence that a person showing no symptoms can pass the coronavirus to others. How easily the virus spreads. How easy a virus spreads from person to person can vary. Some viruses are highly contagious, spread easily, like measles, while other viruses do not spread as easily. Another factor is whether the spread is sustained, spreading continually without stopping. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community spread, in some affected geographic areas. How can we prevent coronavirus transmission? World Health Organization, WHO, recommends frequent and thorough hand washing as the best method to prevent virus transmission. WHO also recommends regular disinfection of frequently touched surfaces such as doorknobs, handles, handrails, restroom surfaces, medical instruments, computer keyboards, phones, office supplies and children's toys. Using barriers such as gloves, masks or condoms can help avoid the spread of germs. Many infections can be prevented by keeping healthy with attention to good personal hygiene. So, that is all for today. Thank you very much for watching. Please don't forget to comment, like, share and subscribe to my channel.